Welcome to the Friday Focus. My name is Dr. O from E&S Orthodontics, and today I'm going to be talking about oral hygiene and braces. Whether you're a patient or whether your child is in treatment, one of the major concerns people have going into orthodontic treatment is taking care of their braces. And one of the concerns is, how does a child, or how do you maintain good oral hygiene throughout orthodontic treatment? And so you have to understand, when you get braces on, all of a sudden you have some foreign objects in your mouth, and then the braces plus the wires just makes it a little bit more difficult to clean your teeth like you normally are used to. And so what we wanted to do today is I kind of wanted to just review a couple things that we have or recommend. And I always make a joke with patients and with people in the practice about, you can never have good oral hygiene unless your toothbrush actually hits your tooth. So just wanted to keep that in mind as we're going through this. And so one of the simplest ways that we have to clean teeth is actually just a toothbrush and traditional dental floss. And if you use this correctly, and well, that's what we're going to teach you how to use it, there's 5 surfaces to a bracket. And when we're cleaning teeth, that's one of the things that you're going to want to do is you can get really good effective cleaning as long as you're using your toothbrush in the proper manner in different directions. And it takes a little bit more effort because you got the wire and the bracket in place. But if you use if your hand skills are good and you're diligent in your time, you can do a really good job brushing with a normal toothbrush and using dental floss. Now, for some people, that becomes a challenge. And so what we're here out to do is we're really just concerned about hygiene. And see, I have no vested interest other than having clean teeth during orthodontic treatment and healthy gums. And so for some people, a normal like a regular toothbrush and floss works. And then one of the other things that we find to be really effective for people is we actually recommend using an electric toothbrush. And using an electric toothbrush offers the ability for water to be pulsated in between the teeth and around the brackets, and it helps gets the teeth a little cleaner and keeps the brackets a little clean. And so with the Oral-B system, the thing that we like about it is Oral-B has a specific orthodontic head that you can use to help clean your braces in and around your brackets. And then it also has a clock, so children who don't want to time how long, you have children who say, oh, I've already brushed my teeth and they've only brushed their teeth for 15 seconds. Well, this has an automatic timer that makes sure that they've brushed at least 30 seconds in each quadrant or in each section of the mouth. And so the other part is sometimes we get people who brush too hard. And so this has a nice sensor built inside that allows you to detect when you're pushing too hard on your tooth. So this system is one way to help facilitate oral hygiene. And like I said, some people like it. They like it more than the toothbrush, but to me it doesn't really make a difference. It's whatever you use. Now, some people like an alternative to flossing. Some people just don't like to floss. They find it difficult to floss with braces. And so then there's a water pick that you can use. And so the water pick has a reservoir which you can mix mouthwash in, and it actually will pulsate water in between the bracket and the gums and in between the gums. And this is actually system is, if you actually read what it says, it's actually shown to be 50% more effective at getting plaque away. And so some people like this system, especially at home. But again, a lot of times if you have, it has multiple heads, so you can have multiple kids using it. And again, it doesn't replace flossing, but it can't, but if you're not going to floss, this is an alternative to it. Some people don't like it because it's too much water, and so then there's an alternative. If you don't like the water system, you can use what we call an air flosser. An air flosser is this machine, and what it does is it pulsates air in between the two teeth, and also sort of kind of making plaque go away or disrupting the plaque that forms around the brackets and the teeth. Now, so again, what we're doing is we've created a system, and we don't care which product you use as long as you're getting the results we want with your hygiene. So you have the electric toothbrush, you have a water pick, you have normal regular toothbrush and floss, and then there's an air flosser that's at your disposal that we recommend. Now, if you are having trouble with hygiene and you get to the point where you're starting to get early signs of gingivitis and what we want to do, or you're prone to cavities, then what we'll do is we'll actually recommend a product called Carie Free. And what it is it's a prescription toothpaste and rinse, which helps like control the pH balance in your mouth. And it's been probably the best product in the market in terms of helping reduce gingivitis and reducing the microbial plaque counts that cause gingivitis to form. And so then also we're able to use it for helping reduce cavities and that. So, you know, this combination of things we have here are really just tools for you to choose. We just ask you to choose one and use it effectively, and then that way we can get the orthodontic results that we want during treatment. And we just find that if you're doing your job cleaning your teeth, then you make orthodontic treatment go a lot faster, because if you really think about it, I love giving this analogy, although it's a little long-winded, but if you have all these baby cells in your mouth, these baby cells can turn into any type of cell. They can either become a tooth-moving cell, or they can become a cell that fights off infection. And so if you have 1,000 cells in your mouth and half of them go to become to fight infection versus all of them becoming tooth-moving cells, then you can see that you will actually slow down tooth movement. Okay, so again, ask us about any of these products. Again, any product will do as long as you're using them. And so hopefully this gives you a little bit more insight into oral hygiene and what's available to you to make really good educated choice for what works best for you or your child. So have a great weekend. It's been great to talk to you this week, and we'll see you next week at our next Friday Focus.